Hi guys, I wanted to share some information. I know it's been a minute since I have posted anything about my breast cancer journey and all the different procedures and whatnot. Honestly, I haven't had the bandwidth. I've hardly had the bandwidth to even talk to my most inner circle, which I haven't talked to a lot. But I wanted to share what I did today. I had to have my uterus scraped. Here's why I'm sharing it. When I started taking hormone therapy in my early 50s, I now know that there should have been a transvaginal ultrasound as a baseline to see the thickening of my uterine lining. Why is this important? Because when the uterus gets to a certain thickness, that's a risk for uterine cancer. Okay, so fast track, that never happened. I get a cancer diagnosis back in December. I go through all these surgeries, and then I finally meet with my medical oncologist, who did order a transvaginal ultrasound, and she was shocked that I'd never had one. So that was early April. It came back that I had a cyst on my ovary, happened to be avascular, so that's good, and my lining was thick. So my girl, Jenny Huberger, here's a side note. I have had to assemble such a team around me to get the full care that I deserve and that I need. Most women, they go with their medical oncologist and they just do whatever the medical oncologist says. With knowing or unknowing, and this is something I want to share as well, a lot of the medicines that were prescribed for treatment also have a bag of side effects that are not good. So back to Jenny. She is my women's health specialist. She does everything down around my vajayjay. She specializes in skin, and she has been amazingly proactive, because I'm not taking tamoxifen, on testing and care, as has my naturopath oncologist who specializes in endocrinology. Okay, so she then ordered, or she got the results of my first ultrasound, which shows thickening of the wall. She wants to do a biopsy, so she does a biopsy. It comes back fine, but she then orders another ultrasound to compare and contrast about a month and a half later. Now, between that time span, I did take tamoxifen, but for only 2 weeks. Tamoxifen side effects are cardiovascular disease, uterine cancer, on top of, I was suicidal, horrible. I cried every day, straight line, horrible, joints hurt, fast track into aging. It's horrible. So I quit taking it for quality of life choices. But in between, there was enough time where I wasn't on it, and the second transvaginal ultrasound showed that my lining of the uterus continued to get thick. So she wanted me to go see a gen onc, a gynecologist that's also an oncologist, and Dr. V. So I went to go see him in June. He was very perplexed why the lining continues to get thick, which is a risk factor for uterine cancer. So I've already had a hormone positive breast cancer, and let me just say, we do not know that hormone therapy caused breast cancer at all. That has now been debunked, the Women's Health Initiative. So if I had to do it again, I would take hormones. The way that I feel now, I want estrogen back in my body. I would take hormones and not think twice. And my hope is that somehow down the road, I can take hormones again. Again, quality of life. So I go see Dr. V. He wants to scrape the inside of my uterus, and that's what I had done today. They found a polyp. Doesn't know if it's benign or not. It can be precancer, it can be cancer, they don't know. But this is my message to all of you. You have to do the research, be your advocate, ask questions, Cancer is so fucking daunting. I'm very tenacious and strong and a fighter, and I'm exhausted. All of it is exhausting. And right when I feel like I'm getting footing, I get another peck of something that rattles me back to, we're not in Kansas anymore. So make sure you do your due diligence. If you're going to start taking hormone therapy, ask for an ultrasound so you have a baseline. If you've never had one and you're on hormone therapy, get one so that you know what you're dealing with. If you are taking any of these cancer treatments, such as tamoxifen and an aromatase inhibitor, and your med-onc has not prescribed a transvaginal ultrasound, ask for one. You need to know what you're dealing with, because all those things have a side effect of uterine cancer, possible uterine cancer. So again, they're focused on fixing and preventing recurrence with the cancer that you had, but all these other things are swirling around too. So you have to do your due diligence. Ask for a transvaginal ultrasound so you know what you're dealing with. I've got so much more to say. I just wanted to get on here for a minute because I walked, so my mental was able to share this story. Takeaway, cancer fucking sucks. It sucks. And I thought I had found a grief counselor that specializes in oncology a couple weeks ago. My friend Katie recommended, after her mother died of cancer, and I was so hopeful, but I'm in Washington and she doesn't do cross state lines. So I hope I found somebody else. The grief that comes with survivorship is really interesting. What makes it hard is I know I look great. When I presented in LA, I look great. I'm getting my strength back. I look great. That's what I'm told. But what's so different is that my insides are very disconnected to what my outsides look like. My insides don't look great, and they don't feel great. So that's the most recent update, and I've got to wear a pad. Do you know how long it's been since I've had to wear a pad for this procedure today? I am surrounded with the best care ever that I have assembled. I love each and every one of them. I'm so thankful for, I'm just so thankful for word of mouth and friends connecting me to this and to that, and then getting highly regarded feedback. Go get an ultrasound in your vajayjay. Go see Jenny if you want some questions around women's health. She is amazing. She's so proactive and she cares so much. I get personal messages from her. I am so thankful. All right. Until next time.